morning. This is Michelle Smith. I am the State Coordinator for Action for Healthy Kids. I want to welcome you to our first webinar of the school year 2017-18 for SHACs, School Health Advisory Councils. This will be covering School Advisory Councils 101, so some of the basics. We'll talk a little bit about coordinated school health, which is the model we've used for years, and then introduce the whole child model a little more for those of you that aren't familiar with that. Then we're excited to have Kelly Meadows with us, who is going to share some of her experience. She's one of our award-winning School Health Advisory Council associates. So we have lots to cover, so I think we should just get started. These webinars are brought to you by our organizations working together under Action for Healthy Kids. In the past, the Department of State Health Services had school health coordinators who were able to work with the districts, but those have been done away with. So these groups you see here have all been working together to try to be supportive of school health advisory councils. The YMCA has done some work individually. It's Time Texas has done some work and training, and they host a website for us. Department of State Health Services is still providing resources. And then the other partners you see here all participate in serving on School Health Advisory Councils. Just before we get started, obviously you can use either your phone or your computer to listen to and view the webinar. You will be muted during the webinar. You can still submit questions, and we hope that you will. I'm just going to type those in, and then we will have some time at the end for Q&A. Let me see, it says speak up. Let me see if I can increase the volume a little bit. Hopefully that's a little bit better. The webinar is being recorded, and we will send a link and slides out following today or tomorrow, usually, with any resources that we want to include. Some of them we'll mention, we'll probably send along with the link. So you'll have those. And then if you're interested in CEUs, It's Time Texas will be sending certificates out by the end of October or early November for CEUs. So what is the School Health Advisory Council? Well, it's to help students learn to the advisory council that assists the districts in ensuring that local community values are reflected in the district's health education instruction. SHAC should be appointed by the school board. It's a voice for parents and the community, and it's a really good way to educate the district and the school board about how important health is to academic success. SHACs are mandated to review all health-related curriculum, and over the past 10 years, the scope has expanded for SHACs to include all components of a coordinated school health program. It is an advisory committee. The board does not have to automatically adopt recommendations from the SHAC, but they are to consider recommendations from the SHAC before making changes to health curriculum. SHACs have become more and more essential. They are mandated by state law. All SHACs are to be appointed by the board. As I mentioned, they're a voice for parents and a way to share importance of health. I think somehow I got those two on there twice. Why do we need school health advisory councils? SHACs have become more essential because so many of the issues and risks our children are facing are behavior related. And since our kids spend the majority of their days at school, it's important to recognize and support healthy behaviors and ensure that they have a safe and healthy learning environment. SHACs can help do that. They're the connection between schools and the district in all matters related to health and wellness. Our schools are so overwhelmed with paperwork and testing, unless something is mandated, it sometimes gets ignored. So SHACs basically make sure that the things that impact our children's ability to be successful, like getting physical activity, having nutritious lunches that they'll eat, ensuring there are policies in place on bullying, even making sure they have a safe place to play. These are items that are driven by district policy, and SHACs can ensure that district policies reflect parent input on what's best for your child and all children. SHACs bring focus to the important role health plays in the learning environment. You're not just sending a brain to school to learn, you're sending a whole child. And if that child is hungry, or tired, or he's sick, they won't learn and they won't be successful. SHACs can bring focus to the whole child education, support the district, encourage parent involvement, support the schools, and help drive district policy around health and wellness. Let's talk about some of this is just a little quick quiz we use when we're doing SHAC trainings on what is the law and what, it just gives you an idea of some of the mandates for school advisory councils. True or false? SHAC or is a chair or a co-chair of the SHAC must be a parent. This is true. This was put into place because we had a lot of district personnel chairing SHACs, and the problem is if you come up with a tough decision, sometimes whoever's in charge of the SHAC, if they work for the district, would be more concerned about what the superintendent might think than what the parents might think. So to help alleviate that problem, we worked with the legislature and came up with the policy that the chair or co-chair must be a parent. SHACs are required for each individual campus. This is false. School advisory councils are district level advisory councils. We're not seeing slides. Okay, I'm sorry. Okay, let's try again. Now I hope you can see the slides. It's one of those mornings, guys. Do you ever have one of those days? SHACs are not an individual campus thing. It is recommended that each campus have a wellness team, but school advisory councils are a district advisory committee that reports to the board. SHACs must report to the school board at least once annually. This is true. School health advisory councils have an opportunity to hopefully get in front of the board. We have a policy at Austin ISD that we present to the board once a year in person, and then we also file a report. A lot of districts have not been able to get on the agenda for their boards, but they still should be submitting a report to the board. We highly recommend that if at all possible that you get to talk to the board at least once a year. SHACs must meet at least 4 times annually. This is true. In a lot of cases, we had SHACs that were only meeting once a year, and you can't really do much if you only meet 1 time a year. So again, we worked with the legislature to put in the code that school advisory councils need to meet at least 4 times a year. SHACs must be comprised of at least 5 members appointed by the school board. We talked a lot about this policy. A lot of smaller districts have a hard time filling positions, especially when half of your school advisory council should be parents. So it is true that at least 5 members, you need at least 5 members, and they should be appointed by your school board. This again was another way to bring the SHAC in front of the school board and make sure that the school board was aware of who's on the SHAC, and and by appointing those, that does not mean that they have to identify 5 members. The SHAC itself can work on that, but we do want to make sure that the board appoints those individuals. The majority of members must be staff employed by the school district. I'm sure you can guess that this one is false. The majority of the members must be parents who are not employed by the school district. This is not to say that staff employed by the school district should not participate. Of course, they would be great and valuable members to the SHAC. It just means that we want to make sure that we have representation from outside of the school district so that there is a good composition of community and school. SHAC recommendations must be submitted to the superintendent before changing district curriculum. This one's kind of an odd one. It's false because the SHAC does not submit necessarily to the district. However, we have always made it our policy that we submit all of our recommendations to the district, because if the district does not support it, it's going to be a lot more difficult for the board to endorse it. But if you have an issue where you have come up with a recommendation that your SHAC feels very strongly about, you can take it directly to the board. It is not required that the district approve the recommendation before it's submitted to the board. It is recommended that the district review SHAC's recommendations. They don't have to implement them, but they should be considering them. There are some other SHAC recommendations, the number of hours for health education instruction, things around, we've added a few in the last couple of sessions around type 2 diabetes and mental health concerns that are included under the Coordinated School Health Framework. We've always been the guide for human sexuality instruction, and two other ones include trying to get schools to work more closely with their community by implementing joint use agreements around using school facilities. It doesn't have to be a formal joint use agreement, but considering ways the community might be able to access school facilities is really important, especially in the rural areas. And then SHACs are also to make recommendations on daily recess. That was implemented several years ago. It doesn't mean you have to have a specific recess policy. It doesn't even mean that you have to have a policy. It means that the School Health Advisory Council is supposed to make recommendations. Please enter a number. We're having a little issue with our phone here.
Please enter a number followed by the pound key.
Interesting. Just hold one moment. Yep, it's definitely one of those days. Okay, so who are School Health Advisory Council members? The majority, as I mentioned earlier, are parents of students and they are not employed by the district. Other people that should be considered part of the SHAC are community members, school administrators. It's always helpful to have some teachers, PE teachers, the child nutritionist from the district, students, business community, different individuals that would have a direct relationship and job skills around certain components involved with health. Also, I think one of the ones that is really important would be have somebody from the school board. We have a school board member. They're not voting members on our SHAC, but they are a member of our SHAC, and they make sure that the information that we're doing gets to the school board sometimes in a more timely manner than if we didn't have them on our board. So before you get your School Health Advisory Council started, or even if you have an advisory council, sometimes they need to take a step back and assess the district. What you see here are some key resources for doing assessment. The School Health Index is this gold standard that most districts use. Extra Healthy Kids has an abbreviated version you can do online on our website. The complete School Health Index with all components is accessible online through CDC. WellSat also has an assessment tool, and as does the Alliance for Healthier Generation. These are all great tools for you to use to help you see what's going on and help you get your School Health Advisory Council going. Then you want to work on developing a plan. You're supposed to be helping the district address health issues. We started in Austin with the 135 minutes of PE back when that was the first mandate. Then we moved on to things, we had some bullying issues, so we had a subcommittee that worked on processes and policies around bullying, and that was approved and put into place. we had vending machines with a lot of unhealthy options. So the SHAC asked if we could have members part of the review and bidding process to make recommendations on products that should be included. Right now, we're working on sex ed, which is sometimes controversial. We passed a recess policy last year, which we're very excited about. So we have tried to determine the issues that were most important to our community. I think the one that's the hottest topic for us in the last few months has been around school nurses. And so we have been working with our health services department on how we can make sure that we have school nurses and adequate for our school campuses. So you need to assess your district to see what your critical issues are and whether you have community support for a change and how best to proceed. The school nurse issue brought so many parents out. It was very exciting. But if you're on an issue that parents aren't embracing, then you're going to have to take a little bit different approach to things. Making recommendations is your first priority, but you may also be charged with different projects by the school board or school administration. At one point, our school district asked us to look into policies around breastfeeding on campuses by parents, which was a little out of our normal realm, but it was a request, and we certainly took it seriously and involved the correct people, and then went back to the district with some recommendations. So when you get started, I think it's really important to develop bylaws and guidelines so that you have definite directions for people. They know what's expected. They know what their boundaries are. We use subcommittees that are related to the components of coordinated school health, and those committees then bring in resource experts so that they don't have to all be members of the School Advisory Council and report back to the SHAC. We also like to look at what other districts are doing. We want to make sure. We had a webinar a month ago on the new legislation for the past session, finding out what different types of legislation might be impacting your school district and how the SHAC can help with that. And if you're just getting started with your SHAC or rejuvenating your SHAC, looking for a topic that is easily supported by the community and not controversial can always help you. It's important when you do make a recommendation and it is passed to help with implementation. Sharing information with parents, sending out press releases. You need to help ensure whatever policy you put in place actually gets implemented. Sometimes we get things going and then it just kind of drops off after the policy is passed. You also need to make sure that the people who helped are properly thanked. If you worked with different groups and individuals, recognizing them at your SHAC meeting goes a long way. None of us do this for the recognition, but it does help just to know that people appreciate the work that you're putting in. As you move forward, you'll be building your credibility with the district and the community, but you need to be careful to keep your personal observations and perspectives separate from your SHAC perspective. You'll need to only share things as a SHAC member that have been voted on and approved by the SHAC. In other cases, you may be asked for your opinion, and it's okay to say that you serve on the School Advisory Council, but when you're expressing your opinion, you want to say, in my personal opinion, this is what I see. You will get new members and make sure that their vision is the same as the SHAC vision. Make it sure that you continue to share the history and the progress so that everyone can build and move forward together. It's kind of like starting over every time. It's because you get new members and they don't remember, they don't know exactly what you've been working on. So you just need to make sure that you're carrying that information forward. When you're developing recommendations, we have come up with 5 basic steps. The first step is laying the groundwork. A lot of times people immediately want to go in and make a policy, but they haven't made people aware of the problem and why something needs to be changed. If you don't make people aware, they don't understand the seriousness of the issue, then they're not as likely to be supportive. So building that awareness and support is part of what you need to get done when you first get started. You need to make sure that you include everybody that's going to be impacted, students, teachers. Yeah, anytime you're working on something, when we worked on vending policies, we involve principals because they rely on the funds. We involve students because they're the consumers of the products. So you can't sit up here as a SHAC and make decisions without engaging all these people. If you engage them and you identify the problems and find either solutions or find good ways of explaining why it's important to make these changes, then it's going to go a long way towards making it easier for your recommendations to be passed. Then you're going to draft your recommendation. You're going to want to make sure that it's solid, that it's founded on, expert or evidence-based data. If other districts have also implemented a policy that's similar, are there national standards? All these things need to be considered when you're working on your recommendation, and make sure that it's clear, simple, accurate. The SHAC will share some resources. They have some documents that can help you with that. Then to get it approved, if you're using a committee structure, then the committee would bring it back to the SHAC. The entire SHAC would vote on it, making sure you have a quorum, and then the recommendation would move forward either to the district to discuss or to the board. Then you get to implementing the recommendation. Again, this is where you work with the district. Then make sure that whatever recommendations you had approved, that you include those in your report to the board, to make sure that the effort's maintained as years progress, and then share the information with the community so that they are aware of what's going on as you move forward. I mentioned the Department of State Health Services. They work with the SHAC, which is the Texas School Health Advisory Council. This is the state School Health Advisory Council, and over the past few years, they have developed several tools that can help you. One is the SHAC self-assessment. This can be used for SHACs that have been in place for a while to determine if what you're working on, how well you're working, if what you're doing is what you're supposed to be doing. And then you can consider including the results from this self-assessment in your annual report to the board. And speaking of the annual report to the board, as I mentioned, this is something that you can either do in person, and DSHS has developed a PowerPoint that you can customize, a template, along with some instructions for its use. Hopefully you would be able to do that in person, as well as possibly a written report. Then, as I mentioned, research and recommendation documents. This is information that you can use that helps you, if you're trying to make a recommendation on a specific topic, help you determine what exactly that recommendation should look like, how should you word it, where would you go to find supporting information as you're developing those recommendations. And then this is a document that Texas Action for Healthy Kids developed, based on one from one of our members who was in Leander, Ray Langlois, and it is based on the School Health Index. So you can take this document and score your school district or score your schools on, do you have a healthy vending policy? And this way you can help establish priorities for your school. The higher the score on these, the more likely you would be that you would want to spend some time on these issues. Again, these may show something that you can add your own issues to it. I know in San Antonio, we met with the school district and their SHAC, went through this assessment process, and what they actually identified was the concern for kids being hungry on the weekends. So their SHAC's first priority was identifying programs and making recommendations on how to help with the hunger problem. And they ended up partnering with the food bank and developing backpack programs, and the School Health Advisory Council was instrumental in helping with that. When you're thinking through possible focus areas, keep in mind the criteria you see listed here. This is also part of that document. Is this problem one that impacts a majority of students? How serious is it? Is there a good strategy that you can put in place Is there support and are there resources available? Or is this something, if there's going to require funding, how would that happen? Is this the actual problem, or is it a symptom and you need to dig deeper to get to the actual problem? Having your SHAC or even a group of concerned parents go through this process will give everyone an opportunity to express concerns, and it'll also help determine which areas have the most interest and the most support. Where can you learn more? There is a lot of information available for School Health Advisory Councils now. DSHS has the School Health Advisory Council guide that was updated a little over a year ago. Texas Education Agency and Texas PTA, as well as the Department of Agriculture, all have information that can be helpful to your SHAC. And then the specific laws are put into code, and so that we also have the website for that. NASB has a state policy database if you're interested in specific policies. And then CDC has the Coordinated School Health Information. And then CSPI is an organization that works on nutrition specifically. And they have some great publications on improving school food and beverage environment. And then we'll also give you the CDC School Health Index link as well. So that is a quick run through on SHACs. I apologize for all the minor distractions this morning, and hopefully we'll pass all those. The speaker we had lined up for the whole school, whole community, whole child model was unable to join us this morning. So I'm going to share their slides with you, and I can still answer a few questions. I won't be as informed as they would have been. The Whole School, Whole Community, Whole Child model was launched in March of 2014 by ASCD and CDC. And you can't ask me what ASCD stands for. They dropped the actual words and just go by the acronym now. Health and well-being have for too long been put in a silo, both logistically and philosophically, not a part of education and learning. Charles Bosch, in his meta-analysis, Healthier Students Are Better Learners, called for a renewed focus on health as the missing link in school reforms to close the achievement gap. No matter how well teachers are prepared to teach, no matter what accountability measures are put in place, no matter what governing structures are established for schools, educational progress will be profoundly limited if students are not motivated and able to learn. But in the same publication, he also stated, through rhetoric, support is increasing. School health is currently not a central part of the fundamental mission of schools in America, nor has it been well integrated into the broader national strategy to reduce the gaps in educational opportunity and outcomes. The traditional school health model has been a mainstay of school health since 1987. By the U.S. Centers for Disease Control, this model has provided a succinct and distinct framework for organizing a comprehensive approach to school health. However, it has been viewed by educators as primarily a health initiative focused only on health outcomes, and has consequently gained limited traction across the education sector at the school level. We know that learning and health are related. In fact, they're interrelated. One might even say they're symbiotic. Where one succeeds, that success feeds the other. Health and education impact individuals, society, and the economy. They must work together whenever possible. Schools are a perfect setting for this collaboration. Approximately 95% of all U.S. children and youth attend school. Schools are one of the most effective systems for reaching children and youth to provide health services and programs. In line with that, more deeply integrated health services and programs integrated into the day-to-day life of schools and students represents an untapped tool for developing the whole child and raising academic achievement. 7 years ago, ASCD, which is the leading global education organization with over 140,000 members, launched its Whole Child Initiative, setting in place the most effective means to ensure that each child is healthy, safe, engaged, supported, and challenged. Simultaneously, ASCD called for communities, educators, parents, businesses, health and social service providers, and others at all levels to forge a new compact with our young people to ensure their whole and healthy development. ASCD challenged communities to redefine learning to focus on the whole person, encouraging schools and communities to put aside their battles for resources and instead align those resources in support of the whole child. Policy, practice, and resources must be aligned to support not only academic learning and growth for the success of each child. In Texas, schools have had a mandate to implement coordinated school health for grades K through 8. This supports the whole child model, and these are the 8 components that have been in place since the 1980s. 2 of these components were expanded on to make the new whole child model, and we'll share those with you. The whole school, whole community, whole child model calls for a collaborative approach to learning and health across the community, across the school, and across sectors to meet the needs and reach the potential of each child. It places onus on all who are part of the school to see themselves as responsible for both learning and health, and diagrammically highlights the relationship between the sectors. When we promote the health and well-being of students, staff, classrooms, and schools, we're developing the environment which is also most conducive to effective teaching and learning. When we learn who our students are, enhancing connectedness between them and the school, we not only increase their sense of belonging and safety, we also better understand what makes our students tick and can better adjust learning methodologies and content to fit. When we reach out to families and the local community, we not only expand the safety net, we also empower key stakeholders in the responsibility and the purpose of education. As you can see, greater emphasis has been placed on these key areas in the new model. The social and emotional climate and the physical environment have been separated. Previously, it was just the environment, school environment, so that we're putting more emphasis on the actual school itself, the building, and then the social and emotional awareness of the schools. The other part was community and family engagement. This was one single component under the old coordinated school health model. They've been separated out to show that there is importance for the family engagement as well as importance for community involvement. So there's a brief video I'm going to share with you that explains the whole child model.
For too long, health and well-being have been put into a silo, kept both logistically and philosophically separate from education and learning. Yet we know that both health and education affect individuals and society, as well as the economy. Health and education must work together whenever possible, and schools are a perfect setting for this collaboration. In 2013, ASCD and the U.S. Centers for Disease Control and Prevention convened a group of leaders to strengthen a unified and collaborative approach to learning and health. The result is the whole school, whole community, whole child model. This new model combines and builds on elements of the traditional coordinated school health model and ASCD's Whole Child initiative. It responds to the call for greater alignment, integration, and collaboration between health and education. The model expands the components to 10, placing greater emphasis on the psychosocial and physical environment and highlighting the ever-increasing expanded roles that community agencies and families must play. The new model also outlines how the school, staff, and students are part of the local community. While the school may be a hub, it remains a focal reflection of its community. The components surround the tenets of a whole child approach to education, those that ensure that each child is healthy, safe, engaged, supported, and challenged. Finally, the new model returns attention to the ultimate focus of the two sectors, the child. Join us in ensuring a collaborative approach to learning and health for each child, in each school, and in each community.
So hopefully this has been a good explanation, and you have a little bit better understanding of what the whole child model is as it compares to coordinated school health. Again, it's not doing away with the components from coordinated school health, it's just enhancing them. So the work of the SHAC will still focus on all of those different components. Now, I'm sure you're tired of hearing me talk. I would love to introduce Kelly Meadows, one of my favorite Action for Healthy Kids award-winning volunteers and school health advocates. She has done some fabulous work down at little Cypress-Mauriceville, and she is a school nurse. She also directed a project for inclusion project, stay and play recreational area, and she is the chair of the district SHAC. So Kelly, I have unmuted you. Are you available now? She was having some audio problems as well.
Michelle, I'm sorry, you're breaking up. I'm not sure if you're
there you are.
Still talking or not. Here I am.
Yes, great.
When I sent these titles to Michelle, I was actually kind of joking. It appears that I wear many hats. I just happen to be the spokesperson, and am fortunate to have a phenomenal group of people that I work with, and so they do all the work, and I happen to be the mouthpiece for it. We are experiencing some technology here, so forgive me if I'm stepping on your toes or breaking up. Our technology has not been the same since Hurricane Harvey, but we're going to give it a go. Our SHAC has been very, thank you. Our SHAC has been very active for the last several years. When I first came to our school district, we were having trouble getting the SHAC members and being active. We were trying to meet at night at the school, and we had very low participation. So we began looking at our community and what was working in the community as far as other organizations, and found that they did meet at night, but they frequently met at a restaurant. And so we tossed that idea out to our SHAC members that were coming to the school, and they thought that was a good idea. So in order to gather members, we had our school nurses work with the principals and looked for parents that were engaged in the school, that in some regards that might be interested in promoting health, wellness, and safety, or for parents that had raised concerns about health, wellness, and safety in that particular campus. And so the school nurses nominate 2 parents with the endorsement of the principal. And then we looked at local civic organizations that were engaged. Our community is very active, and we have some unique organizations and businesses that promote health that are just unheard of. One of our organizations that promotes health probably more than any other traditional one would be Granger Chevrolet. And that's our car dealership, one of our big car dealerships here, and you would not think that they would be so health conscious and health promoting, but they are. So naturally, they have a seat on our School Health Advisory Council. Our Red Cross, our Lions Club, our local food bank, and Salvation Army, those are all people that we drafted to be part of our School Health Advisory Council as well. We do have, we're in the Bible Belt, and so we have a number of churches in our area, and that's very important to us that we have this support and endorsement and understanding of the different faiths in our community. And so we do have several faith-based ministers that are part of our School Health Advisory Council. We do not have a local health department. We're small enough that we are actually overseen by health departments in other communities, but the local authorities are encouraged to participate and do attend periodically for our School Health Advisory Council. As far as school district employees, we have the Director of Child Nutrition, and the Director of Health, which is myself, we serve as the only 2 district employees on the council. And then we have ad hoc members, which are our elementary director of curriculum. We have an active school health, district health and wellness committee, and that's where our teachers, our administrators, and our PE coaches come into play. And we meet as a district school health that is just employees, and then we bring information to the SHAC, or we receive the information from the SHAC and work within our district health and wellness organization. And then together we will present it perhaps to our DEIC committee, or to our campuses, or to the superintendent and the school board, just depending on what the topic is. Next slide. Michelle, can you hear me? Okay, thank you. Because we did not want to start our School Health Advisory Council over every year and spend a lot of time reinventing the wheel, we do staggering 2-year terms with our members, and that has really helped us keep the momentum going. And our current members kind of adopt a new member and bring them alongside and help keep them engaged. So one of the members will be new from campus each year, and then one of them would have been previous, so that we don't have a breakdown in communication. We do meet 4 times a year. We meet at a local restaurant on the date and time of their choosing. It's a meet and greet. We eat, and it's Dutch treat, and nobody has any issues with that. It's very informal. We're not real big on Robert's Rule of Orders, but at the same time, we are very focused and conscientious of the individual's time, and we want to make sure that we cover the topics that are on the agenda, and we answer any discussions, or we address the issues that have come up since the last meeting, and then we get our homework and we leave and come back together. A lot of times we will communicate and do things electronically in between meetings. So we're actually meeting informally through email, and then have our formal meetings 4 times a year. We do have a parent community co-chairman, and we work very closely together. But at the end of the school year, it was decided that I would present the information to our school board. And so I make a verbal presentation as well as submit it in writing. One of the neatest things that's happened last year with our School Health Advisory Council. We, as all SHACs, are encouraged to do, and that was to look at the sex education that is being conducted by the school, and how does that meet the community's needs and the parents' expectations. When we brought that information to our School Health Advisory Council, we had some parents that were very adamant that they were not going to allow their child to sit in that classroom, and that, you know, they had nothing positive to say about that class taking place. And they felt like, as a parent, that was their place to teach their child. And while we endorse the fact that the parents have every right to teach the child, and we want them certainly to have open communication, we made the materials available to the parents, and they actually passed around the book. And the more they looked at the book, the more pleased they got. And by the end of the meeting, some of our most vocal parents were the ones that were endorsing the book the highest. And they went out into our schools and endorsed it among their friends and the other parents and had their child attend the class, and one of them came back and said that that was one of the best things that could have ever happened because it opened the door for their daughter. She wrote her mom a note, and they began discussing things that were taking place in her life. So the fact that we do have that, and we have, you know, we had the confrontation, the uncomfortable interaction, and the parents actually came out and, you know, after having the opportunity to review it, they became supporters instead of adversaries. So we think that that was one of our greatest accomplishments. We have worked very closely with our district for the wellness policy development. It is a living document and it's ever changing. We work with our school district's health and wellness committee, and we have gone beyond what the requirements are in regards to the policy, just having it address the nutrition and physical activity aspect. We are in the process of doing all 8 components from the, like we just saw, and we've already added in the staff health and wellness and looking at health services. And our next component, I believe, that we're to add in is the social and mental health aspect of it. And so we're continuing to develop our wellness policy and make sure that it aligns with what the state requirements are, but also that it addresses what the needs are in our own community. We have been awarded and acknowledged as one of the 5 school health advisory councils in the state, being very active and accomplishing some of the different goals that we have set. We're very proud of that. Our community is extremely engaged in what we're doing, and you can tell that by our community resource walk. That's an event that's held at Little Cypress Intermediate. It is generally held the Friday before spring break. It is an all-day event. The students 2 weeks before the event are challenged to collect as many laps as they can. They know that they will be walking our walking track during their PE time. We have a half-mile walking track. And so they'll walk during their PE time, and they collect laps by inviting their family and friends to come walk with them. So a schedule is sent home telling them when their PE time is. Because we believe where there are people, there needs to be education, we invite the community from all over the state to come and set up booths that promote health, wellness, and safety, emergency preparedness, and family interaction. So we generally have anywhere from 50 to 70 different booths set up along the walking track, and encourage the families to participate not only by walking but engaging in conversations at these different booths. So the community resources are challenged to explain what services they provide to our community, how to access those services, and how our community can best support those services so that they can continue. Do they need members? Do they need meeting space? Do they need donations? What do they need? These students are challenged not only to collect as many laps as they can, but to collect donations for our 7 adopted charities according to their wish list. Several years ago, when our community was hit hard with Hurricane Rita and then immediately following by Hurricane Ike, we had families that could no longer function in the manner that they had done in the past. So we began looking at where do we go for help. And we identified 7 organizations that were routinely there for our families. They're ones that we either referred families to, such as the Lions Club, the Service League of Orange, the Salvation Army, or they're ones that would fill in the gaps when we needed help. And so we identified 7 organizations. We asked them for their wish list, and then our students began collecting items for that. For some, it's to support the food bank, and so they brought in non-perishable food items. For others, it's paper goods. For the Garth House, we support them. They help us with our children that have been abused and help with the court system and that. And so just according to the organization's wish list. So I have a student body of about 300. My partnering school has a student body that participates about 300. We ended up anywhere from 1,500 to 2,000 people participating that day. So our community resource walk, as you can see, is very supported by our community. And it has allowed the community to see where our resources are, where they're being duplicated, and where the gaps are. And so people that have been engaged and involved in the Community Resource Walk become natural members for our School Health Advisory Council because they want to improve our community and help out our district. So we're really excited and pleased with what we've been able to accomplish there.
You've done a lot of great work.
Thank
I have
you.
a couple of questions here.
It,
If anybody
Yes, ma'am.
has a question, they can type it in now. So the first question was, how many members do you have on your SHAC?
I'm sorry, I'm not hearing or seeing your questions.
You can't hear me? Okay. Kelly,
Yes.
can you hear me now?
Yes, ma'am, I can.
Okay. How many members do you have on your SHAC?
We have 15 that are extremely active. We have, I think, 25 to 30 on record.
Okay. Have you all developed a recess policy?
I'm sorry, I didn't hear you.
Have you developed a recess policy?
I believe you said something about a recess policy.
Yes.
2 years ago, that was a tremendous concern of our School Health Advisory Council. And so in our closing report to the school board, we asked that that be something that they consider for our elementary students. At that particular time, we have 3 elementary campuses, one that is pre-K through 5, one that is pre-K through 3rd, and then the intermediate, which is a 4th and 5th grade campus. Not all students were receiving recess on a daily basis. It all depended on what grade level they were in. We are excited to say last year, for the first time in many, many years, we now have recess on a daily basis. Even with us going 4-hour days like we are right now from Hurricane Harvey, our students still have recess on a daily basis.
Okay, one more question. Do you have
Yes, ma'am.
students on Do you have students on your SHAC?
I'm sorry, can you repeat that?
Do you have students on your SHAC?
Do I have students on our School Health Advisory Council?
Yes.
Yes, we do. We actually had a student this past year that was applying for the Gold Star Award, and that is the equivalent of an Eagle Scout, but for Girl Scouts. And she was very active in our School Health Advisory Council, and she did a project in the community, and we facilitated her winning her Gold Star Award. And hers was in regards to education for, in regards to anaphylaxis. It's not theatrics, it's anaphylaxis, particularly focusing on food allergies. We have different students that are part of our School Health Advisory Council, depending on what time of the year it is. We do bring information back to them and engage with our students through our different organizations and get input that way, because a lot of times the ones that want to be engaged just can't make the meetings.
Awesome. Thank Kelly. I appreciate your work and appreciate all you're doing to help the students. Thank you for being with us, even though you just experienced a hurricane. I can't seem to keep the phones off today, can we? If there aren't any more questions, Kelly, can you mute yourself? Because I'm getting feedback.
I can try.
Okay, that's great. Nope, it's still coming back.
I don't have going anything on.
There you go. I think I fixed it. Well, for those of you who joined us today, thank you for your patience with our technical issues. We've had a few of those. Thanks again, Kelly, for joining us, even though you're working with unusual circumstances, and in spite of the issues with technology that you're facing down there. Know that you're in our thoughts, and we hope that things return to normal quickly for you. Someone asked if they would get a copy of the presentations. Yes, we will send a link to the recording as well as the PowerPoint out, along with some of the resources that were mentioned, either today or in the next couple of days. Check the Action for Healthy Kids website for additional webinars upcoming. We have one on October 24th, where we have a couple of our schools who are going to present on their work around wellness policies and other activities. We have a coalition in Central Texas that has been working with different SHACs on recess policy. So I think that should be an interesting webinar, and hopefully we won't have so many technical difficulties. Thanks for joining us today, and have a great rest of the week.